G'day and Swaddy Carb. Well, today we had one of the most important talks, if not the most important talk we've ever had in the history of the Expat Club. And it's a subject that is very relevant to you and everybody. It's what to do if there is an emergency, right? Where time, for instance, there's a stroke, time is brain, right? Heart attack, obviously, or bleeding out or whatever. These are essentially important things to life. And we were very lucky to have Dr PEMISA here giving a talk on her experience. She's an emergency doctor at Bangkok Pattaya Hospital. So firstly, did you always want to be an emergency doctor?
It's very good, and it's very good experience also to be emergency doctor in Pattaya. Yes, and I see many patients that in the critical, and many patient is like in the crisis is very important about the time to get the definite treatment. Yeah.
So actually, we had an emergency doctor from Australia there, and he was very impressed by the talk and the processes that Bangkok Pattaya Hospital go through. So those of you who don't know, there's a lot of different hospitals in Pattaya, but undoubtedly the go-to emergency hospital is Bangkok Pattaya Hospital. And why is that?
Because first, if you think about emergency, please think about 1719 is Bangkok Hospital Pattaya number. And because we have all the specialist doctor that prepare to take care of you. And in the case of like a heart attack or stroke or the trauma, we have 24 hours of the specialist doctor also.
Now, here is one of the most important medical piece of equipment that's now exists. Your mobile phone, okay? Set it up so you're ready for an emergency. You can go on YouTube and you can set it up so that it's easy to call emergency numbers. And here, as she said, one of the emergency numbers you want to have in your phone is one more time?
1719.
Yeah, work out what the emergency numbers are in Thailand, because there's 1331 is a go-to emergency number too.
Another number is 1669 also. But if you want to call Bangkok Hospital Pattaya directly, you have to call 1719.
Yeah, so work out the emergency hospital that's closest to you, that's really geared up for 24-hour care, wherever you are, and make sure you've got that sort of number in your phone. And one of the things you went through is like how important it is to have 24-hour specialist care available.
Because all the second of your organ is very important. We have to save your heart, we have to save your brain, we have to save your extremity and your life. So time is very important to get the specialist treatment.
Yeah, so especially with strokes, time is brain cells, right?
Yes, it's like for the stroke, for example, you have to detect, after you detect yourself, you have 4.5 hours to hospital to do the MRI or CT scan, and you're gonna get the definite treatment after this.
Yes, and is there anything, one sometimes hear that if you think you've had a stroke or somebody's had a stroke, you give them aspirin, is that right?
For aspirin for the stroke, we're going to give in hospital only because we have to confirm that you have no bleeding in the brain. You have the ischemic stroke or hemorrhagic stroke. But if we can do the scan and we confirm that you not have the hemorrhagic stroke, we're going to make a decision that which medicine we're gonna give to you. We depend on time that you can detect yourself, and it depends on time that you arrive to hospital also. So more than the aspirin, we have like a thrombolysis and the thrombectomy to do the operation for the stroke also.
And one of the other things is the really importance of preparation. So, for instance, you can go to Bangkok Pattaya Hospital and you can register your insurance and your passport and all those sorts of things. So it's much more easy to process you, and you're living well if you don't want to be revived, okay? So this is something that you're really well geared up for it.
Yes, we need your passport because we can confirm about yourself, and we can do the pre-register for you in the ambulance also. So we not time in the emergency crisis that you are, so you can do the pre-register with the nurse in the ambulance.
Yeah. And one thing I will say, and I say this often at the club because there's an older crowd here, anywhere, any age, if you live by yourself, have a daily check-in with a couple of other buddies on Messenger or Line or WhatsApp or whatever. So if you don't register that day and somebody has a key to get into your room, I was part of a group that saved a woman's life, right? She was diabetic. She would have she would have gone into a diabetic coma and horrible. But because she was part of the check-in group, she got into Bangkok Pattaya Hospital that day, and so she didn't suffer permanent damage. So, yes, that's part of the preparation. Prepare for the emergencies. You know, you're not going to get a handwritten note from God saying, oh, yeah, on this date you're going to need emergency travel. You need to prepare in advance because it could happen to you or your loved ones. You got any other words of advice?
Please detect yourself if you have like a chest pain or you have like the stroke symptom like facial palsy or arm drop or difficult in speaking. And if you can detect as fast as possible, you can call us and we're going to go to that as soon as possible also.
And one more time, the number for Bangkok Pattaya Hospital emergency?
Okay. 1719, please.
Okay, just as well I can remember. She doesn't have to remember it. She's a doctor. She's already there. Alrighty. Well, bye for now and prepare for the possibilities of emergencies in the life of yourself or your loved ones or your best mates.